Let us start today's webinar on an overview of USMLE
Let me
pathway.
take a few moments to introduce this initiative. So, as you all know, our initiative is USMLE Insight. So, basically, USMLE is a long, and it's a long and overwhelming journey. Being a medical student, from the first and second years of med school, it is quite difficult for us to, to gather all the resources and all the information, from our seniors. I think we might lack that support from our med school or from our seniors and everything. Considering my story, I decided to get into this USMLE pathway only after starting my internship. Okay, before the internship, I know nothing about this USMLE journey. I know there is a USMLE pathway, and that's it. I know nothing else. That is because yeah, I've not approached to the journey, and my med school did not introduce me to the USMLE journey. And I think 90 to 95% of the med schools, uh, I think the same situation is going through in all the mid schools. So my our intention is just to give the insights. Overall journey, the overall the Google thing, you can find it everywhere. But the inside and the in between lines of USMLE pathway, what to do, how to achieve it, right from the med school, right from the first year of med school, what can we do? So that is our initiative. So me along with my friends who are like minded, so we all came up together, and just we just created this initiative. I hope you support and just follow, and let us all grow together. So by the way, my name, I forgot to introduce myself. My name is Rakesh Chaudhary Kucherpudi, and I graduated from Consium Institute of Medical Sciences, Amlapuram. I'm 2025 match applicant, and I'm USMLE Insight mentor. Start the session. Next slide. Yeah, introduction. So, welcome to the overview of the USMLE pathway. Firstly, USMLE, the United States Medical Licensing Examination, is a multi-step examination. Okay, it includes a lot to be done right from the application till the match process. There's a lot to do. Starting with the ECFMG registration and application. Okay, and then the step one, step two. They'll all be coming in the following slides. Next slide. So first thing is the ECFMG registration or the application, whatever called. ECFMG registration is must for every USMLE step one or step two applicant. Okay, we can write step one first or step two CK first. That is our wish. No, there is an option to write step one first or step two CK first. So in order to write any step, in order to appear for the exam, the ECFMG registration or the application process is required. It consists of following steps, right from getting USMLE ID or password. This particular ECFMG ID and password is required till your match, till you match into some program. Okay, so keep these credentials confidential and do not share with anyone. And then comes the form 186. Form 186 is nothing but it is the biographical information. It tells the ECFMG about the biographical information, and also few 10th and plus one plus two level educations, and just biographical information of yours. And then comes the notary cam verification. Notary cam verification is a third party source where it verifies your credentials which are present in form 186, and they give it to give it to the ECFMG. So for the notary verification, Form 186 is the required document along with your passport. Two documents, passport and Form 186, are enough for the verification process of notary camp. And then comes the credential verification part, which is the later step. It is done by ECFMG. You need to give your medical school details, everything about your medical school, whether you're a student or a graduate. Okay, which medical year are you, which year in medical school are you in, and the starting date, expected ending date, expected graduation date, expected date to receive degree, everything will be included in the next step. And the credential verification, after filling the application, there is a credential verification part by ECFMG. It is done in two ways. One is the form 183. If the form 183 gets generated, that means you need to download it, get it signed by your principal or dean, whoever the authority is in the ECFMG records. That person should sign it, and you need to physically email it. Sorry, physically mail it or courier it to the ECFMG, or your college can do it in a sealed cover. But when you in person mail it to the ECFMG, make sure the courier is reaching them from the university, from your medical school, and not from you. Yeah, and next comes the EMSWP. It's the electronic verification, where your medical school participates in the electronic verification of all your credentials in your behalf. So yeah, and then obviously you get exam permit, and then the prometric scene, the prometric center comes into picture, and then you need to select your exam date and give your exam. The whole the insight and the step to step ECF registration process is will be explained in further sessions by our mentors. So just stay tuned. This is an overview session, so I'm just giving you the overview points. Just I'm just touching all the points. Every point in detail will be explained in the further sessions. Next slide. So yeah, this is the project timeline. Step one, after the ECFMG application, step one, step two, CK, USCE research, OET, ECFMG certification, ERAS, and then the match day. ERAS deadline, it is ERAS application. It started, I think, 2 days two days prior, 2 days before it started, and the deadline is on September 25th to 27th. And you'll get your match result in the March, probably on the third Friday of March. So yeah, you'll get the result. Next, yeah, coming to USMLE step one. USMLE step one, basically it assesses the science, basic science knowledge and the principles. It is an MCQ based exam, which is an 8-hour exam. So till now we are not used to any kind of such long examinations. Even NEET PG is for 3.5 hours. So you need to be prepared for, you need to appear in the prometric center, and you need to be there for 8 hours. So everything regarding the USMLE step one and the prometric experience and every insight is going to be covered in the further sessions by our mentor. So this is just an overview, as I told you. So yeah, MCQ based questions. It covers various subjects which are included in first and second year of med school, and also the other subjects like ethics, biostats, epidemiology, behavioral sciences, psychiatry. Usually, it is taken after the completion of second year. So, in order to write the step one examination, you need to be done with your basic sciences. Although the curriculum might change these days, but the basic requirement is you need to be done with the basic sciences, and yeah, first 2 years subjects. It is a pass or fail exam these days. I think it came into force from 2021, 2020 if I'm not wrong. Before that, USMLE step one also consists of scoring system. Next slide. Coming to USMLE step 2, CK. Yeah. It evaluates the application of medical knowledge in clinical scenarios. It is also an MCQ based examination, and it is for 9 hours. It is same as step 1 and covers all the clinical subjects. It is usually taken during or after completion of final year or internship. But basic requirement is you should be in your final year of med school. And the importance of step two. So okay, as step one being pass or fail these days, step two CK score is the primary, is the important screening factor in the residency match selection. Okay, so it all depends upon the scores you get. You get the average score or par score, or extraordinary scores. It just depends upon the score. Step two CK is going to be a primary screening factor to get matched. Okay, in the match process, it is a key. It plays a key role. Although the selection process is holistic, that means they select you based on your whole the review of whole application, but step 2 seeker score is the important filtering screening factor in this match process. Next slide. Coming to USCE, United States clinical experience. So to talk about USCE, it takes around 3 to 4 hours to elaborate it everything. I'll just I'll just tell you the overview of USCE. So yeah, USCE refers to clinical experience by medical students or graduates in the United States. United States clinical experience can be obtained through electives or clerkships for the students, observerships or externships for graduates, and the research electives. So yeah, I know that most of the people have doubts regarding USCE. Is everything regarding the USCE. We actually plan 2 sessions regarding USCE. One is how to approach for USCE, how to apply, how to get visa thing, and everything will be covered in one session. And other session we are planning like a life at the life at USC. When you go there, what are the requirements, what are the things to be done and everything. So we are planning every insightful information in two other sessions. So just stay tuned. And yeah, USC allows students to adapt to the US healthcare system and build cultural competence. We can know, there will be a lot of change in the healthcare system in the India and in the US. So the 4 months or 5 or 6, whatever the time you are doing your USC in the US, you will get adapted to the healthcare system. And obviously for the LOR, definitely you get LOR only if you do the USC. So we all aim for a good LOR. So USC is important. Next slide. Um, so next comes OET. OET is the less talked thing among all the steps in the USMLE pathway. OET is an occupational English test in English proficiency. It is designed for healthcare professionals outside the US to test their English language proficiency. Uh, People from engineering side, who are going to their masters in the US, they are no they know they are aware of this English proficiency test. Okay, suppose say IELTS or TOEFL. Okay, these tests, they mainly test you based on your listening, reading, writing and speaking. OET is also same, but in OET, extra feature which we need to go through is the language skills in healthcare context. So you need to you need to give your best, not only in the listening, writing, reading and speaking, but also you need to be aware of the healthcare content, which means the medical terminology and everything. So it is is a bit harder for us compared to IELTS and TOEFL. So yeah, OET is also an important step. OET is must for the ECFMG certification. So do not neglect OET and give enough days of preparation for OET as well. So yeah, as I told you, it is must for the ECFMG certification. It is included in the place of USMLE step to CS. Earlier it is step to CS, and now OET became compulsory after removing step to CS from the curriculum. Next slide. Next, coming to the ECFNG certification. ECFNG certification is required for international medical graduates who wish to pursue postgraduate medical training in the United States. In order to obtain ECFNG certification, IMGs must fulfill several requirements, which all I talked about till now. So yeah, completion of medical education from your recognized medical school. That means you need to be a graduate. Medical students cannot apply for ECFNG certification. Okay, so you need to be a graduate from your particular medical school, and then you need to pass your step one and pass your step two with a good score, and you need to clear your OET, and then you will be ECFNG certified. Next slide. ERAS. Yes, coming to the ERAS. ERAS is the Electronic Residency Application Service, which is a centralized online application platform used by graduates to apply for residency program in the United States. um, ERAS is nothing but a portal. It is used as a portal. It provides a user-friendly interface to enter your personal information, upload your documents, and you can even track your application process. First, let me talk about the documents which are needed to be uploaded in the ERAS. These days, the ERAS application, the rules have changed. So everything you have done in your medical school journey and the USML journey, it can be uploaded in the ERAS. For example, the CVs. Some people wish to apply for multiple programs, so you need multiple CVs, right? And personal statements, letter of recommendations, medical school transcripts, MSPE, which is the medical school performance evaluation, or dean's letter, and several other documents. You can upload all these into the ERAS document session, which I'll be showing you, which is the next slide, the dashboard of ERAS. So yeah, documents are securely transferred, to the programs, which saves our time. If this portal is not available for us, so we should send each and every application, which every paperwork and every document to the program. I think we should be applying for around 100 to 150 or 200 programs. So it is hard for us to send every document to each and every program. So this is used as a portal. This port is ERAS acts between the applicant and the interviewer and the program interviewer. So they can just open your ERAS application and they can find every information out there. Yeah, next slide. This is the dashboard. Can you zoom it? Yeah, starting from the left, it consists of, first block consists of your personal information, biographic information, educational information, experience, which includes your volunteering experience on job experience, and the licensure and the publications. All your research publications can be, you know, entered in this session. Coming to the other documents, you can upload LVARs, and then personal statements and medical school transcripts, dean's letter, status report, and your photograph. And coming to the next session, it is all about the programs. For all the 100 to 150 or 200 to whatever number you are applying to the programs, whatever you save the program will be applied in this session. Okay, and it divides among saved up programs and programs which you applied, so it is easy for you to access it. It just takes off the confusion. It shows everything in detail. So ERAS application is very important, and preparing for ERAS is equally important. Before entering into the interviews, you need to take at least 2 to 3 months, or some people take 4 to 6 months also to write their SOPs, to to prepare for ERAS, to write, to work on their CV and everything. Yeah, next slide. Yeah, coming to step 3. Step 3 focuses on the application of medical knowledge in the context of patient care. It is also an MCQ based and also computer based case simulations. It is generally taken after graduation from med school and successful completion of your step 1 and step 2 CK. Step 3 is not required for ECFMG certification, but being an international medical graduate, clearing step 3 adds on advantage. Okay, consider you having some red flags like multiple attempts or already year of graduation or any kind of red flag. Giving step 3 before getting into match process, or before getting into interviews, it adds an advantage. So even if you don't have any red flag, you're an IMG and it's a red flag. Yeah, so consider writing a step 3, giving step 3. Passing step 3 is, it's enough. Nobody judges you based on the score of step 3, so just pass step 3, and you can add it to your ERAS. Even you can add it to your ERAS after your ERAS application also. That means the ERAS application starts, you'll upload all your documents, you'll apply for the interviews. Even before getting interviews, or even getting interviews, you can tell the interviewer that I have given my step 3 or I am waiting for the result, and later on you can add your step 3 result to your ERAS. It is taken in the US. Unlike step 1 step 2, step 1 and step 2, you can have your home country advantage, you can write in India only. But coming to step 3, you need to be in the US to take the exam, which is a 2 days examination. Yeah, it is 2 days. Next slide. Coming to the interview and match, the final stage of residency pathway, it is a crucial step. Also, the program directors or other faculty, they assess the candidate's suitability for their residency program. These interviews nowadays are conducted virtually, especially after COVID. I'm hearing news that they might be real in person again, but as of now there is no update. Even the 2024 guidelines also doesn't uh, say anything regarding the physical interviews. So as of now the interviews are virtual, which is an advantage for us. Okay. So I heard some resident story where that particular resident, while he's going through the interview session, there is a panel of 4 to 5 members who is interviewing him. And just imagine giving your viva to 4 to 5 externals and internals together sitting at one place. It's hard, right? So this is even more harder. So as of now virtual interviews are better. We can prepare, we can prepare for the virtual interviews and we can give it as of now. Usually, yeah, in the interview, usually the aspects other than medical knowledge. Okay, see, the information you put in your CV and the ERAS. Say for example, I heard a resident story. Again, I need to mention it here. So one resident, you know he spoke about his volunteer or job experience. He has worked as a medical officer in Amazon rainforest. Okay, so I think he got around 6 to 7 interviews, and each and every interviewer is interested upon that point. Okay, and then after the interview, the programs the programmers or the interviewers who interviewed that applicant, they spoke about him regarding, oh, that guy, that Amazon rainforest guy who did the volunteering job there, yeah, he's a nice fit. Yeah, see, you need to be unique in your own way. Okay, so in interview, 99.9% the interviewers are not going to test you based on your medical knowledge. You have gone enough enough, okay, proving that you are worth by step 1, step 2, and everything. So in this part your medical knowledge is not at all tested. I'll say not at all. They might ask you for any explanation regarding any case. That is very rare. Even that, if you mention it in your CV only, they'll be asking you, or else they'll just stress on the other issues or the other volunteering things which they feel interested. Okay, and the communication and other skills will be tested. If the interviewer feels the candidate is the correct fit for their program, the candidate will be matched, which we are all waiting for, hopefully. Next slide. So yeah, concluding the webinar, this session is just an overview. I'm telling you again, we we provide the insight and between the line information for you guys. But this session, it is a overview. That's it. I'm just introducing the USMLE pathway, overview of every step of USMLE pathway. Insights and thorough explanations of each aspect mentioned in this overview will be discussed in further sessions by the mentors. So just stay tuned. We'll try to provide all the insights and between the lines. Keep supporting us. Let us grow together. And yeah, all the best for the USMLE journey. One second, guys. I'll just share the Google Forms. Considering following us in USML, Instagram, USML Inside is our official page. We will be posting in the WhatsApp group. We will be posting daily 2 UL questions and explanations, and the flashcards for those questions will be uploaded in Instagram. And any other update regarding the USML pathway will be updated in the Instagram. So considering following there also. One second, I'll just add this Google Form link to the chat. Yeah, please fill this Google form before leaving, so that we can know the information. By the information you provided, we can know, we can what would be the further sessions. What can we, how can we, you know give you information regarding other sessions also. And so guys, now the session is over, but Q&A is open. You can just, I'll be answering the questions. If you have any questions, please, you can ask me there. The Q&A is open. You can ask me regarding any question, any doubt. You can ask me, so I'll be answering those. I think I got it. Some. Can you share your PDF in the WhatsApp group? Yes, yeah, I will be sharing the PDF. I'll be sharing the PowerPoint in the WhatsApp, and also the session recording of the session. Hopefully, I think I can share it. So if you have any questions, we are open for the Q&A. Q&A. What about a dermatology residency? Don't we get for IMGs, or is there any possibility? Okay, that's a good question. According to the recent NRMP match data, okay, IMG friendly programs, and there are categories, right? So dermatology is one of the competitive branch. Honestly speaking, we don't get dermatology in India. In India also, only if we get a good great rank in the NEET PG, we get dermatology. But in the US, it's quite difficult, but it's not impossible. You need to, same thing. You need to mold. You need to do everything regarding dermatology. Everything, every research, every volunteering. Your CV must be tuned into such that you are the preferable candidate for dermatology. It is not impossible, but it is quite difficult compared to other programs. You need to have that patience also. So your fellow applicants will be matching into some other program whenever they apply. So IM, peds, pathology, everything, they'll get matched. But you should not, you should have patience. And yeah, you should wait, you should try hard. and then one day successful, you try to build the connections. You try to find dermatology residents, use LinkedIn and Twitter as the source to find the residents who matched into dermatology. How many posts? As of now, I don't know the exact data of how many posts available. If I could find, I'll definitely share it in the WhatsApp group. As of now, I don't know the exact data of good time for step one preparation. Which year of med school? Yeah, that's a good question. So good. Um, I don't say this is the good period to start. Even from right from the medical school, you can start preparation. But considering first aid, okay, considering first aid, it is like Greek and Latin if you open for the first time, being in a first year or second year of med school. Because in our med school, you should be aware of the terminology at least first. So yeah, consider preparing it from your second year. Buy a first aid, or you can do it in the hard copy also, you can get it. And Kaplan gives you a good knowledge. BNB is quite, it is more a little more complicated than Kaplan, so try Kaplan for the first time. And complete the videos, and try studying first aid in while it is hot. Don't buy it, but you can get it online. So study first aid and try Kaplan. But there is no specific time to start. Giving steps early is an advantage, so you can start it at any point of time. And we also spoke, among our mentors, we thought of giving you a session on approach of medical students, being in of first year and second year medical students. More than preparation, I would say the academic preparation, I would say you just focus on your volunteering. Okay, volunteering and research. Yes, research. There is a category of research called literature reviews. Okay, literature reviews, which can be done even in your first year and second year of med school also. So focus on that, and everything regarding research will be, the session will be conducted soon. So stay tuned. And volunteering, there is nothing fancy about volunteering. Whatever, see, for example, the SPM department, they conduct some event on some particular day. On World Diabetes Day, they conduct diabetes camp. You go there, you just volunteer, you just know what is happening. You just attend a physician, or you just shadow of a professor, just know what is happening, and you can add that in your CV also. Okay, so it might be a medical or non-medical, anything. You just do volunteering, which shows your interest towards doing something to the people. Okay, in the first year and second year, do that. And regarding the academic thing, you try Kaplan and first aid. Yes. Are externships good as clerkships? Okay, so regarding this question, yes, something is better than nothing. So externships are also good. Externships are hands-on, so they are basically good. The only thing is, you are not getting externships as a graduate in the academic setup, right, in the university. That's the only minus. I don't say it is a minus. Okay, so anything is better, but clerkship is more better only if you do in the academic setup. Okay, so LWAR, the way of LWAR, it should not be generic. It should give you it should give the interviewer overview of your strengths and weaknesses. That's it. So externships are also good, and most of the people applying for USMLE are graduates. So only externships and observerships are left for them. So externships are also good. There is nothing less and that, nothing more. Only the LOR matters. Try getting particular LOR, and yeah, the LOR should not be generic. That's it. How to build CV? Yes, I already told you. I hope you're in first year. Which year of med school are you in? Can you please specify? I can tell that. Sneha. Third year. Okay, you came a long way. So yeah, as I told you, volunteering. Yes, volunteering. and research and experience is are the three best ways to build your CV. Volunteering, I told you, just go go into anything which is being organized in your college, med school. Don't feel like, okay, my people might mock at me, my friends might make fun of me. Don't, no, make your involvement, involve in everything. And I think if any conferences or CMEs or any state conferences, medical conferences being conducted in your college, do a workshop volunteering, okay, or do a cultural volunteering, anything, do anything, and you can add that to your CV. And coming to the research, as I already told you, literature reviews, and you are already in third year, you try to do some case reports, okay. Case reports, you can do it with the help of your professor. And literature reviews you can do on your own, a group of friends can do it. And volunteering, that's it. You can, and that's enough to build your CV being in third year. And don't forget, you cannot do anything on your own being in your third year, right? You cannot treat patients, you cannot you cannot go out and conduct a medical camp. So don't put such details there being in third year. You can just volunteer anything, any type of volunteering works, any type of research case reports works. And literature reviews works. And few people even do original research, meta analysis, or systemic study being in third year also. So yeah, you can do anything like that. How would you recommend as a good mentor for research work in Kim's with did not get you. How would you recommend as a good mentor for research work in Kim's? Sorry, I didn't get your question. I think if you're asking about research work and finding a mentor, it differs from medical school. Okay, these days ICMR has introduced a program where you can find a mentor among your professors. You can find a mentor. You can reach out to them. I think they'll be from PSM department, so you can reach out to them, and you can just ask them that I want to join in whatever research you are doing. I want to shadow you. You can make a case report. You can just find a professor who is a mentor. So it differs from college to college. There is no specific person to become a mentor. That is, you need to choose one. You should approach your professors, and yeah, try consulting the HOD of specific department. They know everything about this ICMR and that thing. That particular professor who is already registered in ICMR, he or she can be your mentor. I think someone is raising their hand. You can please ask your question by unmuting yourself. What can we do in first year USMLE? Yes, as I told, volunteering. You just do volunteering. For example, I'll tell you a small incident. Okay, um, in our college, the PSM department along with emergency department, they collaborated, and they did this thing called disaster management, where all the students from first year and second year, they just had a makeup. They created a bomb blast scenario. They had a makeup, and they performed a small skit or play, how to even a lame person can understand it. So nothing related to medical here. So when a natural disaster occurs, how can we escape? That play really got my attention. But unfortunately, I was in internship during that thing, and we are not allowed to do it. You can attend that also. See, you can attend that. You can add it to your CV. And once the interviewer is interested upon that thing, you can just explain what happened there. That's it. That is your volunteering, that is your experience. And as I told you, research first years can also do literature reviews. You can just do you can just do the literature search online, and you can do it. Regarding the literature reviews, the research session is going to be done very soon, so just wait. Volunteering, research, enough. That's it. And any college conferences you can attend, you can host a workshop. Yes, you can do that, right? You can host a workshop, suppose BSS workshop, basic surgical skills, or BLS. You can host a workshop, and that's it. You get a certificate from the conference, and you can add that to CV also. And one more point I want to mention here is, you need not have certification for everything what you've done as experience or volunteering. Only thing I ask you, uh, only thing I ask you to be honest enough and be genuine. Okay, I tell you not to fake anything, but if you do fake something in your CV or ERAS, try prepare for that. Okay, prepare for the questions you get from the interviewers. So if you say that I have volunteered in specific medical camp, I have volunteered in a flood relief campaign, they'll just ask you where the flood has occurred, what have you done for how many days. Just be honest. That's it. You need not give any certification proof to the interviewers, but just be honest. Check my inbox. What? I didn't get any. No, not related to Kim's, but yeah, I think every college conducts conferences. Every college conducts some important, workshops or some important things on some important days. At least World Diabetic Day, World Breastfeeding Day, and everything. I think you consult your SPM department. So you just show them your interest. Tell them that I want to pursue USMLE, and I need something from my first year, second year. So I want to get included in everything which is done from our college and department. So yeah, every college does it. College preferences, branch wise, any? Sorry, I didn't get you. What do you mean by college preferences? Are you talking about the US or in India? Okay. Before answering Sneha's question, US, there is nothing like there is nothing like you do your residency in the college. Okay, there is a hospital setup, be it academic or non-academic. It is a hospital setup, right? So there is no like this thing called this college. You get this and you will get matched into the no. It is all about the program and the interview. If you get a program from which is affiliated to Harvard University, yeah, you're working at Harvard. Or if you get a program from a corporate hospital, you're working at that place. It all depends upon where you get matched in your interview. That's it. There is nothing like a specific college system. Nothing like, it is totally different from the NEET system here. Post COVID, everything got changed, so we hardly have any programs going on. Okay, if you have no programs going on from your med school, try try getting them from outside. Okay, so there are many organizations, Indian Red Cross, a disaster management thing, even for this recently happened Orissa train accident, there are many NGOs, conducting many camps. You just go through them. We will be mentioning, I'll try to, our mentors will try to mention something regarding the networking session also. They'll be giving you insight information of what you can do. But as of now, in detail, you can do Indian Red Cross activities, and there are, I think, Lions Club, Rotary Club activities, and everything. And if there are some medical camps being conducted in your nearby places, you can directly approach them. I'm a medical student, and I want to do some volunteering thing, and they'll definitely include you. You just need to know how to check the BP, and that's it. Yeah, any kind of volunteering works. It should not be, volunteering thing should not, it should only be medical thing. No, nothing like that. Any kind of volunteering thing works. So yeah, find getting volunteering experience outside your medical school, if nothing is being done at your college. College wise posts. No, I have already answered your question. There's nothing like college wise posts. It's all about the programs. It is either in the academic setup or non academic setup. It is all about the program, the interview, and the program which you're matched into. If the program is affiliated to Harvard University, you're working at Harvard. If your program is something somewhere a corporate hospital, yes, you're working there. If your program is is affiliated with some other university, you're working there. That's it. It is all about the program and the interview. And I think I'll give you some information regarding residency application interview applications. So regarding the applications, there are few 2 to 3 websites where you can find the find the programs which you are interested in. If you are interested in internal medicine, that particular websites give you a clear information about where the programs are and the names of the programs, whether they are academic based or not. Everything will be in. I'll just post that in the WhatsApp group. There are 3 to 4 websites. I have the thing in my mobile. I'll just forward it. You can go, you can have a look at it. Any more questions, guys? And consider filling that Google form, please, so that we can get the information from you. We can tune the next sessions accordingly. And we have our mentor also here. If you can say hi at least, or if you can add anything, letters of recommendation. Yes, what do you want to know about letters of recommendation? Sorry, did I miss any question? Letters of what do you want to know about letters of recommendation? Can you specify? How will you get them? Just by doing your USC. That's it. Any Yes, there are LORs are must. Okay, US clinical experience is must. When you go to do your US clinical experience, you it varies. There is 2 week program, 4 week program, 6 weeks, 8 weeks, and the program duration varies. But 1 month is recommended. 1 month at a program. You doing USC is important. So based on your work, based on the work which you have done in the 1 month of your rotation or observership, the program director writes in behalf of you. He writes a recommendation letter. It should not be generic. Okay, you can just request the program director to give you a non-generic LOR. You can ask him to highlight your strengths and weaknesses, and you can just do your best, give your best there, being attentive and everything. That particular session is going to be done soon by our mentor, so you'll know everything what to do there. But yeah, USC is really important. LWARs are really important. If you are a US medical graduate, you need not do any USC because you're already done, and your HODs or professors where you have done the med school, they'll give you LWAR. But being an IMG, LWARs are must. I think I heard. I actually should mention one point. 7 to 10 years back, residents from IMG residents, they told me that LO, LO, what is LOR, what is USC? That is not at all important. Observership is not at all important. The things have changed a lot. So we have come a long way through. Nowadays, LORs are really important, and your USC is really really important. And USC is considered one of the consideration point if you have any red flags, which means if you do a 6 months of USC, if you have 7 months of USC, it might be considered as a as a cover to your red flag also. So it is important. Clinical rotations budget required, how many months needed? You 3 LORs are must. ERAS allows you to upload 4 LORs. So you can say 4 is the minimum and maximum is your wish. But try to try to highlight the 4 LORs which are, you might get 10 LORs or 7 LORs by doing 7 months or 10 months, but try to highlight the LORs which are good for you, and not generic LORs. You putting them in forward in the eras doesn't work. So get a good LOR and you can get in uploaded that in the eras. Clinical rotations budget, it is a hypothetical question. So you can get rotations by free by mailing the programs, or you can go through agencies where you should pay a lot of amount. It all depends upon the, the source where you get the USE. That's it. It differs according to the source. Telerotations better. Okay, if you ask me, in my perspective, post COVID, when all the countries opened their immigrations and most of the programs opening the rotation, yeah, I agree. Few programs are yet to open, clerkships or externships to IMGs, but most of the programs have applied. So in this scenario, exclusively telerotations doesn't work. During COVID time, you can upload all the LORs based on telerotations because you have no chance of going there. But now one telerotation works. One telerotation LOR and the other LOR should be, in-person LORs. But having two or more telerotation LORs, I think that doesn't work. Considering USC, that doesn't work out. If you have stellar scores, that doesn't matter. But holistically, if I should say, one telerotation is okay, but not more than two, more than one. And even the COVID emergency has, the WHO has lift up the COVID emergency also, in these. And I think by the time we apply, everything gets normal. So almost all the programs might open also. So telerotation doesn't count, in my opinion. Any more questions, guys? So yeah, I think we are done. So yeah, we'll just wind up. Thank you for the bearing me for 1 hour. Yeah, we hope we'll do better with the coming sessions. And if I miss any question, or if you want to ask any question, you can directly ask in the WhatsApp group. Our mentors will be answering the questions. So yeah, thank you guys. Have a good day. Bye.